Hey everybody, here's what's ahead this half hour. Western New York dealing with signs of a potential COVID resurgence. We're going to be talking with local leaders about mask mandates, vaccines, and the increasing number of cases. Plus infrastructure plans. We're finally getting some specifics of that long negotiated deal in Washington, D.C. Tonight, a look at the specific impact for Western New York. And among our Olympic coverage, we'll check in with the Verify team to answer a question about gymnastics on this big day for Team USA in Tokyo. We are certainly glad you're here with us. After months of mostly positive pandemic news, we're seeing some troubling trends right now. Not as bad as in some parts of the country, but we are going in the wrong direction right now, and that's leading to the possibility of more restrictions with the Delta variant spreading. We want to zero in right now on Niagara County. Now, this chart dates back to the spring. You can see we had a surge in cases in April, but by the time mid-June got here, we were in great shape. But look at that far right portion. We are now seeing this increase in terms of per capita cases, and we're going to zoom in to just the past month. We started out with just about 5 new daily cases per 100,000 people in Niagara County. We've increased that 6-fold. Only Erie County now has a higher rate of new cases per capita in our region. Let's discuss that right now with the chairwoman of the Niagara County Legislature. Becky Wydysh is a Republican who represents the 2nd District. We appreciate you coming back on the show. We were talking in the commercial. It's been a while since we've had to talk about this.
It has. Things definitely calmed down a bit during the summer. We were seeing those lower numbers, but unfortunately, like in most areas, we are seeing upticks again because of that Delta variant.
Yeah, so we've heard from Erie County Executive Mark Poloncarz saying that he believes Erie County may have some form of a mask mandate within days, starting with county-owned buildings. The key is to stay below that 50 new cases per capita if you're following the CDC guidance. We know Niagara County is approaching that. Based on the trends we just mentioned, if you head toward that threshold where the CDC recommends masks for indoor places, will the legislature there in Niagara County consider making changes or putting mask mandates in place?
We are not anywhere near making a decision like that at this point. Clearly we're watching the numbers. We are seeing that uptick, like I said, but it's really going to be a data-driven decision for us. We're not going to watch just that per capita number. We're also going to be watching our positivity rate over a 7-day rolling average. And really, to me, important is the hospitalization levels. If you look back at the very beginning of COVID, it seems like, forever ago, almost in a way. Really what we talked about doing was not overwhelming our hospitals, and we were able to do that. We're still in a good situation here in Niagara County. We did have 71 new cases from last Wednesday to this Wednesday, but only one of those is hospitalized. So we don't feel that we are in a situation at this point where any sort of mask mandate would be required.
Yeah, hospitalizations are so key. We hope to actually be talking about that on tomorrow's shows because we are starting to see a little bit of an increase, but thankfully nothing like we saw, even just a few months ago. I guess a lot of people are wondering if these mask mandates don't happen at the local level, if New York State is going to step in and say you have to follow the guidance from the CDC. And so we may technically have a mask mandate in Niagara County. I'm wondering of getting your opinion. Erie County Comptroller Stefan Mihailu came out today and said if that happens or if Erie County puts one in place, people shouldn't listen to it. They should just blatantly violate what is essentially the law. What would you tell residents in Niagara County if, in fact, there is a mask mandate put in place?
Well, first of all, I don't believe that the governor can do that at this point. We're not under a state of emergency in New York anymore for COVID, so I don't believe, and I believe he said this himself, that he does not have the authority to do that, which is why it's coming back as a local decision. What I would say is I continue to tell residents to be mindful of your situation and to keep yourself safe. You have a duty to do that. We know that if you're not vaccinated, the rule is that you're still supposed to be wearing that mask around others. And there are certainly people who are vaccinated who choose to still wear a mask. Maybe they have more of a medical concern or they have family members who haven't been vaccinated and they're being more mindful. So again, I just ask everyone to think about their own situation. I do encourage people to get vaccinated. I know that that is not a decision that everyone wants to make. For some people, it's very personal. They might have medical concerns. So again, just asking everyone to be responsible and follow your situation and what you know is right for you and to help keep others safe at the same time.
Yeah, I want to ask you about vaccinations. Niagara County is below the state average when it comes to people who have gotten at least one dose. You still have about a third of adults who haven't done that. President Biden is suggesting and asking communities all over the country to consider this $100 incentive to maybe add a little encouragement to people. Let's listen to what he said just within the past half hour or so.
I'm calling on all states and local governments to use funding they have received, including from the American Rescue Plan, to give $100 to anyone who gets fully vaccinated. I know the paying people to get vaccinated might sound unfair to folks who've gotten vaccinated already. But here's the deal. If incentives help us beat this virus, I believe we should use them. We all benefit if we can get more people vaccinated.
So would Niagara County consider doing that type of incentive, using some of the money from the federal government and giving people $100 if they'll go and get the shot? And then I guess more broadly, what do you think is behind some of the hesitancy where you live and among your residents?
That, of course, is the first time I've heard President Biden's suggestion being so new and just happening. I wouldn't anticipate that happening here in Niagara County with American Rescue Funds. I can't speak for the full legislature, of course, but for myself, I wouldn't see it happening. You know, I know that incentives will work for some people, but I really think that we're at a point where it's very easy to get a vaccination. If you want it, they're available, they're out there. We continue to make them easily available for anyone who is looking for one. But we are down to a portion of our residents who have decided for one reason or the other that they just don't want to do that, whether it's for their own medical reasons and concerns, hesitancy about what might happen long term after having the vaccination. Some people just don't think it's necessary. They don't think COVID's a concern. They're not worried about getting sick because they're young and healthy. Whatever those reasons are, I think we're far enough into this that if they haven't done so already, there's very little chance that they're going to. If incentives work for a handful of people and we can get a few more done, that's great. If that's what it takes for someone to make that decision is a free gift or a free ticket or whatever's being offered, then fantastic. I hope that works. But I really think we're down to the portion of residents who have just decided they're not going to. You know, when you knock on doors and ask people at their home, would you like to be vaccinated? And they tell you no, there's not much more that you can do.
I'm out of time, but before I go, I want to ask you just very quickly, there's also this discussion about vaccine mandates. Governor Cuomo with state employees, the president now just announcing for federal employees. Of course, if you don't do that, you could just be tested regularly or face other restrictions. The governor's calling on local governments to do the same. Is that something that the Niagara County Legislature has considered?
Again, at this point, I wouldn't anticipate that happening here in Niagara County, especially with the numbers the way they are right now. Again, we're nowhere near the point of needing to institute something like that. And I have a lot of questions about the governor's mandate to do that. I know that he's giving the option of testing, but we've yet to hear who's going to pay for that testing. Will the employees have to? Will the employer? Will that be done on their own time, during work hours, personal time? I'm curious to see how this is all going to work and how he's going to make that happen, quite honestly.
Yeah, a lot of questions outstanding on that. We will keep in touch as things progress. We hope that the trend reverses, right? We don't have to go through any of this stuff. It's great to get your perspective. Becky Wydysh is the chairwoman of the Niagara County Legislature. Have a great night. Thanks for your time.
Thank you. You too.